Hi, my name is Stephanie. I'm a board-certified neurological physical therapist and a yoga instructor, and I'm very excited to talk to you today about Alzheimer's disease prevention, a topic that's just near and dear to my heart. And here's my plan for what we're going to talk about today. So we'll start with defining age. What is aging and what are the factors involved in the aging process? Then pivot towards dementia. Dementia, Alzheimer's, are they the same thing? What's the relationship between the two? Then move into couples of statistics about Alzheimer's disease within the United States. Understand the risk factors involved in Alzheimer's disease. What increases your risk for Alzheimer's disease and how do those risk factors interchange with each other? Move into lifestyle choices, how your lifestyle choices can decrease your risk for Alzheimer's disease, and then finish off with the 4 pillars of Alzheimer's disease prevention. So that's kind of like a roadmap that the Alzheimer's Research and Prevention's Foundation put forth to guide us to what we can do to decrease our risk for Alzheimer's disease. So before we go any further, I'd like to acknowledge the Alzheimer's Research and Prevention Foundation. So they're a wonderful group that has done so much work with regards to this topic. They've done work to support research and to get information out to the community about what we can do to prevent Alzheimer's disease. I'm just finishing off their brain longevity specialist training, and so I'd like to acknowledge that a lot of the content and some of the slides in this presentation are from them as a source. Just a wonderful resource for everyone. So let's start off with an inevitable fact. Chronologically, we are all aging. Our country is aging, and as you can see by the pictures, our pets are aging. So this is my first fur baby, Rex, a black poodle. And so on the left is a picture of him when he was just over a year old when we first got him. He's a puppy. He has raven black hair or fur. His eyes are clear. He was very boisterous. And on the right is a picture of him now. He's over 10 and he is still very boisterous and has tons of energy. But you can see how he's changed, how he's grown, and I would say even more handsome. So his fur, his hair is gray now. If you look closely into his eyes, you can see that they're cloudy. He has some cataracts. So think about it. We are all chronologically aging. It is inevitable. So just a couple of statistics about the United States. In 1990, there were over 30 million people age 65 or older. They're projecting that by 2030, there'll be 70 million, and by 2050, there'll be 96 million. So our entire country is aging, and we need to figure out how we're going to deal with this population shift. So what is aging? The researcher, the nerd in me, took all this new technology, AI, ChatGPT, Grok, and asked it what aging was. So first I got this enlightening definition that aging is the process of becoming older. And that was a little disheartening because I've kind of figured that one out already. But then as I kind of went down, they had a nice definition of aging. Kind of a scientific definition is that aging is associated with changes in biological, physiological, that just means your body, environmental, that's where we live and everything involved in that, psychological, behavioral, our mind, our brain, and social processes, how we engage, what we value. So as we age, you have to question, well, why do different people age kind of differently? And it's driven by a lot of factors, not just one. First and foremost, genetics. We're born with a certain body and we will age at a certain rate. Now, traditionally, we thought that how you were born is kind of in the cards for you. But now we're realizing with more research what other factors can impact what's expressed or how your DNA expresses itself. And you could actually not counteract, that's a strong word, but you could definitely change to a point what's expressed in your genes. Then we know that environment who you surround yourself in, what physical environment you're in, all that drives how you age. And then the big one that we're going to talk to and focus on today is lifestyle choices. If you choose to exercise, if you're active, what you eat, your stress level, how you manage that stress level, again, your social role, who you hang around with, who you work with, that all affects our aging process. So nowadays, everyone is talking about healthy aging or successful aging. And what is that? What do they mean by that? Well, it started to be discussed in the mid-90s. And Rowe and Kahn, they developed a model of what healthy or successful aging was. So we're going to go back to math class, high school math class for a second, and we're going to look at this Venn diagram. So they had 3 domains or concepts which are involved in healthy aging. One is avoiding disease. Second is to maintain high physical and cognitive level. Cognitive is just a big word to say how you think, your brain. And then engagement with life. So when you are able to avoid disease, engage in life, and maintain a high functional, physical, and cognitive level, you are in turn successfully aging. So now let's stop and think for a second. What are your beliefs about aging? When you think of aging and yourself aging, what feelings or emotions kind of come up to you? Take a moment. Okay, now I'm going to share to you what I came up with. So let's start glass half full, the benefits of aging. As we age, we hopefully, through our life experiences, get wiser, make better choices, navigate through the world in much more of a skillful manner. We also have more freedom. Not everybody, but you tend to have more of an ability to dictate what you do with your life. You could set your own schedule. You potentially have less responsibility as our children kind of age and move out. That's debatable though, but generally we kind of get to do more of what we want to do. Now the question becomes, what are your concerns? Or I'll even go as far as say fears. I speak to a lot of students, and some concepts or some thoughts kind of keep on coming up to the surface. That would be a fear of physical decline. You can't physically do what you want to. Loss of friends, loss of family. And then I would say a lot of people have concerns about cognitive decline, or they're losing their ability to remember things. They're losing their ability to function in their day-to-day life because of how they think. So let's talk a little bit more about that. So what is normal cognitive aging and what is more of a pathology or a disease process? So with that in mind, Dr. Robert Kiltzman posted an op-ed in the Washington Post, and I think it represents a lot of the difference between normal cognitive aging and potentially a dementia process. He said, forgetting where your keys are is normal. Finding them in the refrigerator and really not knowing what they are indicates Alzheimer's disease. So let's talk a little bit about what is the normal age-related cognitive decline in life. So commonly, cognition starts changing in our 40s. And also the term cognition is a very large term. There's multiple different domains of cognition. It's very complex. Some of them, for example, is processing speed. That's how long it takes you to process information, to think about it, and to respond to it. There's a thing called crystallized intelligence. That's just your vocabulary, your knowledge, your skills that you've kind of acquired throughout your life and through your education and just your normal everyday experience. And then we all have memory. That's your ability to remember past events. That's your ability to learn. You need to have memory in order to learn and acquire new information. So let's dive a little deeper in processing speed and memory. So processing speed in general as you age slows. It drops about 20% when we're 40, which was a number that I was floored at. I did not realize that. And it naturally declines 40 to 60% by the time we're 80. But again, that's very individual. Everyone is a little different. We're all wonderfully unique, which is a beautiful thing. And then memory, same type of thing. It goes down, but at what rate really is individual, and it depends on a lot of factors of the person. And also your memory, it is not abnormal to change daily, depending on if you're got a lot on your mind, or if you're stressed, or if you haven't slept. That will all impact your memory right here, right now for that day. So about 40% of the people over the age 65, it's absolutely normal to have occasional memory impairment associated with age. And that does not mean your dementia. It doesn't mean that you have any cognitive dysfunction. So let's go a little deeper into what dementia is. What is that term? So according to the National Institute of Aging, dementia is defined as a loss of cognitive function, that's thinking, remembering, and reasoning, to such an extent that it interferes with a person's daily life and their activities. They're about their ability to go through their day-to-day activities. Now, what you need to understand that dementia is an umbrella term. It's a general term, kind of like saying low back pain. It really doesn't tell you why you're having the cognitive or the memory problems. There's multiple different types of dementia. Alzheimer's dementia being one, which is the most common, but there's also vascular dementia due to cerebrovascular disease. There could also be frontotemporal dementia, there's Lewy body dementia, there's mixed dementia, which is another common dementia, which means that the reason for someone's cognitive or memory issues is not just one thing, it's a combination of multiple. And with several neurodegenerative diseases like Huntington's disease, Parkinson's disease, there's a dementia generally associated with it later on in the disease process. And what this dementia does is depending on what the disease process is, it causes damage to the brain, which impacts the brain's ability to communicate and talk to each other. So therefore, it doesn't work quite as well. So now that we have an understanding of what dementia is, let's talk about Alzheimer's disease, which is a type of dementia. So by definition, Alzheimer's disease is a progressive form of dementia characterized by severe memory loss and cognitive impairment that mainly affects seniors or senior population, but it can affect people younger. Generally, when you get it younger, it's more aggressive. And sometimes you'll hear in the media about hallmark changes to the brain, and people talk about protein buildup. You hear about amyloid plaques and tau tangles, and that just impacts your ability to communicate with your brain cells to communicate with each other, and that's how you get the symptoms. But there's also other brain changes. There's inflammation, and there's a decrease of your ability to use glucose. Your brain is probably the organ in your body that uses the most glucose. And if you do not use glucose well, if it decreases its ability to use glucose, it won't function as well. And here's a fact that was really kind of interesting to me, is that brain changes from Alzheimer's disease start to develop 20 years in some cases before the symptoms come on. So once the symptoms are present, the process has been percolating in the brain for quite a long time. And as we discussed, it's the most common type of dementia among older adults. And it's multifactorial in nature. So what we mean by that is usually it's not just one reason why someone gets Alzheimer's disease. Oftentimes it's a mixture of multiple reasons, and that actually helps us figure out what to do about it, how to prevent it, how to manage it. So just a couple of statistics about Alzheimer's disease. It's the 5th leading cause of death in the United States in older individuals. And as we said, it's the most common form of dementia. It accounts for about 60 to 80% of all dementias. Now, there are an estimated 7.2 million Americans over the age 65 who are currently living to this at this time with dementia in 2025, and that number is going to, or projected to surge to 14 to 60 million people in the US and up to 152 million people worldwide by the year 2050. Just let that number wash over you for a second and realize how having prevention strategies are so important. 2/3 of individuals with Alzheimer's disease are females. People have postulated there's a connection with estrogen, more a little bit later. And the number of people with Alzheimer's disease increases with age. So age is obviously a risk factor. So 5.1% of people age 65 to 74 have Alzheimer's disease, and that number increases to 33.4% when people are over the age of 85. And this is a very important thing, and it's going to guide us through the rest of our discussion this morning, is that increasingly Alzheimer's disease is kind of being put in the bucket of preventable diseases, kind of in the same in the same level as heart disease, obesity, diabetes, elevated cholesterol. So this is actually very empowering because it means that we can actually do things through our lifestyles to change or decrease our risk factors for Alzheimer's disease. So that naturally brings me to this slide, is what are the risk factors associated with Alzheimer's disease? We need to be able to understand the risk factors before we could potentially change them. So now that we're into risk factors, first thing that we need to understand is whenever we talk about risk factors in medicine, you have kind of like two categories of risk factors. You have modifiable risk factors, or things that you can change, and then there's non-modifiable risk factors. They're things that you can't change. So let's talk first about the non-modifiable risk factors. So the first one and the greatest non-modifiable risk factor for Alzheimer's disease is age. We've talked about how as you age, the risk and the prevalence of Alzheimer's disease, the number of people in the population who have Alzheimer's disease increases. But, and this is a really big but, Alzheimer's disease is not normal aging. So I don't want people to start thinking, well, I'm going to get older, it's natural, I'm going to, suffer from dementia. No, it's not. Older age alone does not cause Alzheimer's disease. Then we have to talk about genetics. So there are many genetic variances that are associated with increased risk for Alzheimer's disease, but the one we hear about the most is the APOE4 gene. It has the strongest impact on risk, but we'll discuss later, and as we already talked about, we're kind of learning more that we aren't necessarily stuck in the genes we have. We can do things that will affect how they're expressed, how they come to the surface. So even if you have the genetic predisposition for something, you could potentially still stave off the disease with various lifestyle choices that you make. And also another non-modifiable risk factor for Alzheimer's disease is family history. So you have an increased risk of the disease process if you have a parent or a first sibling or relative with that disease. So now moving on to modifiable risk factors. These are the ones that are really important because we could do something about it. So the Lancet Commission on Dementia Prevention, Intervention, and Care was put together. It actually was put together, and they developed their first paper, I believe, in 2017 or 2019, and they brought about 9 risk factors that are modifiable for Alzheimer's disease. Then in 2020, they updated it, and again in 2024, they updated it. Each time they updated it, adding a couple more risk factors. So the first question is, who is the Lancet Commission? Well, what these are is a group of healthcare professionals, quite renowned, physicians, neuropsychologists, an interdisciplinary team that looked at the literature or the research on Alzheimer's disease, summarized it, but also did their own analysis to come up with these risk factors, modifiable risk factors for Alzheimer's disease. Now, they actually categorize them by your life stage early, middle, and late, but we're just going to lump them all together right now. And so the 2020 report, you can see the risk factors that are modifiable that they identified was a low education level, so your schooling initially in life, hypertension or high blood pressure, obesity, hearing loss, the fact if you've had a traumatic brain injury or a history of traumatic brain injury, excessive alcohol consumption. Alcohol consumption is kind of like that teeter-totter where some reports you hear, yes, drink, some not, but they identified that excessive use of alcohol was a risk factor. Smoking, depression, physical inactivity. It truly is, and of course I'm biased as a physical therapist, but movement is so healthy for your brain. Social isolation is a very important risk factor. Diabetes, and shocking to me, air pollution. Then in 2024, they added 2 more risk factors to that. They added visual loss and high cholesterol, specifically the LDL, which we call the bad cholesterol. And then you see in these blue stars, you see sleep and diet. So in the 2020 report, they specifically identified poor sleep habits and poor diet as, while they didn't consider it a modifiable risk factor, sleep habits and diet are involved in most of these modifiable risk factors. So they're the key into controlling these modifiable risk factors. And then the other star, which I put in yellow, was stress. If you look into the literature, stress, and most importantly, chronic stress, has unbelievable negative effects on your body. It kind of releases this whole cascade of neurotransmitters, of chemicals that just negatively impact multiple different aspects of you physically. So managing stress is such an important part of preventing Alzheimer's disease and overall general health and well-being. So now we start analyzing those 14 modifiable risk factors. And if you really look at it, lifestyle and nutrition impacts 8 of those 14 risk factors. Like we said, that's really exciting because that's something we could do something about. And here's a powerful number, another one for today. Research indicates that 35 to 45% of dementia is linked to these 14 modifiable risk factors. So they're the holy grail for managing and preventing Alzheimer's disease. So now the other thing to realize with regards to risk factors, individual risk factors are really important, but when you change risk factors in combination, so you don't just address one, you do lifestyle choices that affect multiple, it's exponentially more powerful. So these 6 risk factors or 6 behaviors that you can do can reduce your risk based on the literature for Alzheimer's disease by 50%. That is a huge amount. So what are they? First, diet. A brain-healthy diet with more fruits, more vegetables, fewer processed meats, refined grains, or ultra-processed foods, and we'll talk about this at another time in another discussion. Exercise. Like I said, I'm biased, but activity is very important. There are multiple different types of activities and different components of physical exercise to consider, but in general, at least 150 minutes of moderate to vigorous activity each week is important. Sleep. We don't think about that, but 6 to 9 hours of sleep each night is very important. Sleep is when your body recovers. Sleep is when your body rejuvenates and gets rid of all the waste products that it accumulates during the day. Light drinking, up to 1 alcoholic beverage for women and 2 for men each day. So yes, the men get to have 1 extra than us. Not smoking. That is very powerful. And also maintaining a healthy weight. They say a body mass index of less than 30, but now research is even coming out that percent body fat is probably a better way to measure someone's health than BMI, but again, more on that later. And here's the really interesting facts also, that if you follow 3 or more of these behaviors, you could reduce your risk for Alzheimer's disease by 30%. And even people with a family history of dementia, when they followed at least 3 of the behaviors, were able to reduce their dementia risk by 25 to 35%. So moving towards the key takeaways of our discussion is that aging without dementia is achievable, that the brain normally changes with age, but dementia is not inevitable and dementia is not normal part of aging. And approximately 40% of dementia cases are associated with modifiable risk factors. Those are the risk factors that you can do something about, just very empowering information. And dementia risk can be reduced with lifestyle changes, how you choose to move through your day, if you choose to exercise, what you choose to eat, socialization, and we'll discuss this more, but yoga and meditation is coming out in the literature as very powerful tools to prevent dementia, to promote healthy aging, and to stave off a lot of chronic and even manage chronic diseases. So just to jump forward in what we're going to be talking about in other sessions in future, obviously being a neuro PT, I'm going to say neurology is key. So neuroprotection. What is neuroprotection? That's how we manage and decrease our risk for Alzheimer's disease. So traditionally, if you look in the literature, neuroprotection is thought of as therapeutic agents or medicines that we give people once they have something happen to them. Think about stroke with TPA, or when people have an acute spinal cord injury, there's certain medications we could give them that will prevent the damage to their nervous system. But what we're realizing, and what I want you to think about, is how you move through your day. Your lifestyle choices are also means of neuroprotection. What you eat, if you exercise, who you hang around with, what your purpose in life is, what you do, that all can serve as neuroprotective agents. And then also I'd like to introduce to you the concept of your brain superpower, and that's called neuroplasticity, a really big word that just says your brain can change positively based on the inputs you put into it. So think of like a muscle. If you lift weights, your muscle gets bigger, it grows stronger. Well, the same thing with your brain. Depending on how you think, depending on what you do, those neural connections can get stronger, and you could even develop new connections that weren't there before. And then a large amount of our future content is going to be focused on the 4 pillars of Alzheimer's prevention. So that's what the Alzheimer's Prevention Foundation, that's the roadmap they gave us to how we should live our life, or what lifestyle choices we could make that will just help with prevention of Alzheimer's disease, dementia, and quite honestly, it just helps with overall well-being and healthy aging. So the 4 pillars, the 4 guides that we have, one will discuss diet and brain-specific nutrients. The next one will be stress management, specifically with yoga and meditation. And they have researched what's called a Kirtan Kriya. That's a meditation. It takes 12 minutes a day. And what they found with that consistent 12-minute practice every day, they were able to reduce the risk of Alzheimer's disease and even help people with mild cognitive impairment. That's kind of a precursor to Alzheimer's disease. So very powerful. No medications, no side effects, just something you can do every day to decrease your risk for Alzheimer's disease. Then, of course, physical and mental exercise. So when we talk about exercise, we're not just talking about physical. We'll discuss mental exercise and how you could do things to challenge your thinking processes to improve the connections of your brain. And then spiritual fitness. And what do I mean by spiritual fitness? There's so much involved in spiritual fitness. It's not just connecting to something higher than ourselves, but it's also being surrounded by like-minded people. It's having purpose to what you do in everyday life to feel like you make a difference. So these are all 4 aspects that we're going to discuss in future times that we have together. So in closing, first I'd like to thank you for your time today. And I'd like to finish off with just hitting a couple of points that we talked about. So aging is complex. It's a multifactorial process. And so is dementia and Alzheimer's disease. A key thing is identifying risk factors and modifying them. They're a very powerful tool in preventing Alzheimer's disease. So the other thing that I learned a lot during my course is the best way to manage Alzheimer's disease is through lifestyle modification. So you identify your individual risk factors and you change those risk factors. You put lifestyle choices in place that address each and every one to hopefully prevent or delay the Alzheimer's disease process. So thank you very much for your time today. And remember, we're all in this together, and I'm looking forward to our future time together to explore all these 4 pillars, this guide to help us with good lifestyle choices to protect our brain health.